Hey guys, it's Nurse Gwenny. Let's talk about blood cultures. So blood cultures are used to identify bacteremia or bacterial growth in the bloodstream. And we do it by taking two sets. Well, why do we have these little bottles? These are bottles that are filled with bacteria food to encourage bacterial growth. And this red cap, this is anaerobic, meaning this one has no oxygen in here, and this is aerobic, meaning with oxygen. It's important that we get both because some bacteria can grow in the presence of oxygen and some can only grow without the presence of oxygen. And we get two sets to rule out contamination, because we don't want to accuse someone of having bacteria in their bloodstream that's really just bacteria that was on their skin and we didn't scrub it well enough, or maybe there was a bacteria here on the cap. So that's why we get two sets from two different sites to reduce that contamination. Now, another thing we can do is you have got to scrub the site really, really well. Now, I'm an ER nurse. I have one speed and it's 1,000 miles an hour. I want to just slather this on here and go on and stick, but you've got to let this air dry. You're supposed to let it dry for 2 minutes to kill off all of that flora, that normal bacteria on their skin, so that we don't get some of those germs here inside this bottle and accuse our patient of having bacteremia when it's really just normal flora. So what happens after we draw these? So we put about 3 to 5 mils of blood in each of these bottles and we send them down to the lab, and then we put it in an incubator for 48 hours. Again, it's got that bacteria food in there to encourage growth. So we put it in that incubator for 2 days. That's about body temperature, and it's got this bacteria food, and we're trying to encourage bacterial growth because we want to see if there's anything in there. Then after 48 hours, if there's been some growth, we do what's called a disc diffusion study. So we put some of this bacteria on an agar plate or like a petri dish looking thing that you would see in a science lab, and then we put several little paper discs of different antibiotics. We put it back in the incubator, and then we watch it for another 24 hours to see which which antibiotic the bacteria is most susceptible to. So which antibiotic is best for this specific infection. And then that helps us to guide which antibiotic to give our patients who have bacteremia. So I hope that helps you understand blood cultures.